Perhaps it's time for a walk. Is power really worth it?
Order. In accordance with Standing Order 38, a motion to adjourn the House is deemed to have been made and seconded at this time. Therefore, the question is that this House do now adjourn. The Honourable Member for Kitchener Centre.
Thank you, Madam Speaker. I'm back tonight to continue to raise the alarm on the impacts of the poison drug crisis on my community, and specifically tonight on the federal funds that are needed to act. The reality is, in my community, this crisis continues to have devastating impacts. This year alone, 72 more deaths from poison drugs. In fact, just in the period from October 11th to the 21st, earlier this month, 5 more suspected poison drug deaths. Each one a loved member of my community, like Alby, who I spoke about in this House recently, or my friend Hudeyfa, who passed away earlier this year. Every single one a preventable death. Now, in the midst of this crisis, this federal government has a program specifically for prevention, harm reduction, and treatment initiatives. It's called the Substance Use and Addictions Program, or SUAP for short. It's a $359 million program. And good news for this government, we have 2 experienced, credible organizations who applied for this very fund from Waterloo region, both Sanguen and Community Healthcaring. Sanguen has even been funded by SUAP before. I was thrilled to join the then Minister of Mental Health and Addictions, our former colleague, Carolyn Bennett, alongside my colleague from Kitchener-Conestoga, last year to announce a previous extension of SUAP funding for Sanguen's Community Health Fan. Yet this year, both applications from Waterloo region, neither one successful, meaning 0 SUAP dollars are going to Waterloo region. Even if we got just the average across the country, while in recent years program funding varied between $104 to $145 million a year, if you average it out across the 5 ridings across Waterloo region, it would mean between $1.5 to $2 million. At a time when we need more of everything in the face of this poison drug crisis. We need more treatment, we need more mental health supports, we need more safe consumption sites, we need more safer supply, we need more harm reduction. Instead, both provincially and now federally as well, our community is actually getting less. It's why I met with the minister and her team when we began to hear news of these funding decisions back in July. And, you know, the best they can do is talk about a new fund that's being set up that nonprofits and charities in my community and others across the country won't even be eligible for, with a hope that more money might get announced in the future. And so what it means is that organizations like Sanguen and Community Healthcaring are going to have to begin to wind down programs by March 31st of next year if nothing more is done, at a time when we actually need them doing more. The other reality, though, is beyond those 2 organizations, what we need is SUAP money to be delivered to communities like mine, not words of aspiration. And so my question again tonight is, will the minister commit to reviewing these SUAP decisions to ensure that hotspots like Waterloo region are not overlooked?
Parliamentary Secretary to the Minister of Families.
Thank you, Madam Speaker. The overdose crisis has impacted far too many lives across our country, affecting all Canadians. Each loss of life due to the dangerous, illegal, toxic drug supply is tragic, creating a heartbreaking reality for families, friends, and communities throughout our nation. This pain ripples through society, leaving grieving families and communities struggling to heal. The Government of Canada is deeply concerned about the devastating effects of substance use, particularly the ongoing overdose crisis. We are committed to taking decisive action to combat this crisis and save lives. Addressing the overdose crisis requires a comprehensive approach rooted in public health and public safety. Depuis 2000,
Since 2017, we have committed over $1.2 billion to support access to evidence-based prevention, treatment, and harm reduction services. We have also supported research and strengthened law enforcement efforts against illegal drug production and trafficking. Health Canada's program, Substance Use and Addictions Program, has invested over $650 million in over 420 projects, including over $15.5 million allocated to projects in my colleague's community of Kitchener-Waterloo. Community-based organizations across the country are working tirelessly to reduce stigma and provide vital support for individuals who use substances. In our ongoing commitment to address the overdose crisis through Budget 2023, we committed $144 million to fund more community-based supports and evidence-based health interventions through a national call for proposals under the SUAP program. This initiative garnered an overwhelming response, totaling nearly 700 submitted proposals and over $2 billion in funding requests. These proposals underwent an extensive review process, and successful applications were selected for their ability to deliver innovative, community-led approaches that could be sustained and scaled up. The unprecedented number of applications we received highlights the severity of the overdose crisis in communities across our nation. It reinforces that our work is far from over. Together, we will continue to prioritize the health and well-being of all Canadians and address this pressing crisis. Moving forward, we announced $150 million over 3 years, starting in 2024-25, for an emergency treatment fund available to municipalities and Indigenous communities. This fund will facilitate rapid response to critical needs related to the overdose crisis, including enhancing connection to treatment and expanding harm reduction services across Canada. These investments reflect our commitment to prioritizing the health and well-being of all Canadians. We will continue working with partners to combat this crisis effectively. Thank you, Madam Speaker.
L'honorable député de Kitchener Centre.
The Honourable Member for Kitchener Centre.
Speaker, I appreciate that my friend and colleague, the Parliamentary Secretary, spoke about past funding that has come to Waterloo Region. But what I'm hoping that she and the Minister can realize is that the argument that we got a lot of applications and money ran out isn't good enough. First of all, because she's part of the government that set the total dollar amount. That obviously wasn't enough. But then secondly, that no one's done any thinking to say, wait a second, Waterloo Region's a hot spot. Wait a second, we've had 72 people die in this community this year already. That it's not okay in a community like mine to say, oh, we ran out of money. $0 for Waterloo Region in the midst of this poison drug crisis is not okay. And so what I've been trying to raise for months now is a request for this government to look at hotspots like Waterloo Region, find the money to ensure that we're not left without any funding at all to make sure we can stand up to this poison drug crisis.
Parliamentary Secretary.
Healthcare decisions should be made by experts. Funding decisions for that program are also made in partnership with provinces and territories, Indigenous communities, and people with lived and living experiences, because they are best placed to identify projects that should receive funding, not politicians. I know the member had multiple meetings with the Minister and the Minister's office to discuss proposals from his region. We are happy to continue these discussions with him to make sure he understands how funding is allocated to achieve the best results and to fund the best proposals. Je tiens également à souligner l'investissement.
I also wish to mention the historic investment we made in healthcare in 2023. We acknowledge that provinces and territories are the best place to invest in what their health care priorities are. Thank you, Madam Speaker.
For Lanark, Frontenac, Kingston.
Thank you, Madam Speaker. I'm rising today to follow